Sherry Hudson is a registered physical therapist at Miami's Children's Hospital.
After 18 years of doing this is the only way I see that we can make significant progress.
5 years ago, she was introduced to the Koscielny's and the TheraSuit method. She's been impressed ever since.
I've looked at so many different avenues of therapy, especially for the CP child, and this is the only thing that has worked.
The TheraSuit method consists of 5 steps. Step 1, warm up and stretch. The patient's muscles and tendons are warmed and stretched. Hot packs and massage are used to bring blood to the surface muscle tissue. Step 2 targets strength training and range of motion. This step utilizes the universal exercise unit, also known as the cage.
We do both things at the same time, which saves us tremendous amount of time.
I could take a child with the old traditional sense, have them 3-4 times a week at 45 minutes, spend probably 6 months to get not even close to the same results of what I could do with a child just 2 to 3 times a week for an hour in the universal exercise unit.
If you just go once a week for 1 hour throughout the entire year for physical therapy, you will have maximum 45 hours. The 45 hours we accomplish within one intensive session.
Try harder, as hard as you can.
There's a significant change and a lot faster with the cage.
Having the cages allows you to have an extra 8 hands to isolate and hold the patient in a proper position so each muscle is activated and used appropriately.
Step 3 involves doing floor exercises and functional exercises, like going from sitting to standing. The TheraSuit retrains the central nervous system, provides external stabilization, aligns the body as close to normal as possible, corrects gait pattern, and provides deep proprioception to the joints. The 4th part of the program is gait training. This is done with or without the TheraSuit, depending on the specific needs of the patient. This part is essential for the patient being able to learn to walk. Part 5 of the TheraSuit method is additional training with the help of the Universal Exercise Unit. It promotes functional skills, strength training, and stabilization. It also acts as a reward at the end of the session. Another key to the success of the TheraSuit method is the Koscielny's dedication to research.
Knowing Richard and Isabella for the last 5 or 6 years and knowing what they've went through with their daughter's recovery, they've put their heart and soul into this methodology. I have never been so impressed with a couple that not only have found something that works really well, but is extensive as far as the research that they've done.
They are the only people that I would trust because I don't see anyone doing this much research.
They're always looking for information to improve the clinic.
When Janet Miller's son Jacob arrived here, doctors told Janet walking was out of the question. He has since taken his first steps.
It was very emotional for us. It was something that we were told by doctors would never happen, that he would never walk.
An additional benefit and critical component for further development of the patient is the home program. Patients are able to continue treatments without having to spend additional money or travel hundreds or thousands of miles.
And it's been wonderful. I don't think Natalie would ever have come as far as she is without the program.
Dr. Elizabeth Dobina and her husband have been using the home program for the past year. Their daughter Natalie was 7 years old when she began the TheraSuit method.
Then we reached a point where even her therapist said she needs something more because it was just tiny, tiny, tiny steps.
With the help of the home program, Natalie's progress has been remarkable.
We've seen a lot of huge gains, not only in her physical, but also in her speech development also. She sits just like a normal kid would sit, totally upright, which she couldn't do prior to that. She's walking with that walker so much more than she ever would have with conventional therapy.
And when questions arise, the staff is available by phone or email.
They videotape Natalie and they give us pictures inside the folder. So they show exactly how this stretch is supposed to be done. It's very easy to follow.
The results of the TheraSuit method are impressive, and new studies continue to confirm the effectiveness of the therapy. To obtain more information about the TheraSuit Center and the TheraSuit method, or to schedule a consultation, please call or visit us online at www.suittherapy.com to learn more about the new standard in treatment for cerebral palsy.
The children with disabilities, they need fighters for them. And that's how I look at Isabella and Richard. This is something that they're doing from their hearts and their souls, and it shows.